work-related stress is today a collective problem and not an individual one. It affects both developed and developing countries, all categories of workers in all professions, and that is the reason why the International Labour Organization chose that topic for this year World Day on Safety and Health at Work. What we can see among the trends is that there is more and more awareness about the need to deal with these problems, that the problem has increased in terms of the way the work is organized, the way labor relations are developed now, the type of employment patterns we have today. Stress was there for many years, but the intensity has increased and its relation to work as well. And this is what we're seeing as a trend. We also have seen that there's a number of initiatives coming from both developed and developing countries, from policymakers, stakeholders like trade unions or employers' organizations, some networks of professionals that are engaged in trying to find solutions to tackle this problem from the world of work perspective. On workers, you would have both physical and mental health impacts, and they're becoming more and more serious. For example, in terms of physical health, it's closely related to cardiovascular disorders and musculoskeletal disorders. In terms of mental health, it's closely related to burnout, it's closely related to depression and even suicide. You can see also some coping behaviors that are related to trying to deal with a problem they cannot really cope with, that is associated to alcohol and drug abuse, violence at work, some problems of sleep disorders. They're all related to working conditions and working relations and communication issues. In the case of business, the problem is closely related to the absenteeism and presenteeism, to high staff turnover and all the implications of having to train new people and engage new people, the lack of motivation and commitment to the organization when they see that the working climate is not conducive to the well-being of workers, but on the contrary, maybe to violence, maybe to stressful working schedules, maybe to conditions which are not adequate for the workers to deal with those problems in a proper manner. One of the main things is, for us, the preventive approach is the issue. The way we can handle it is dealing with the causes at the origin. These are psychosocial risks, and they can be identified in working conditions, working relations, the organization of work, the way the tasks are designed. And if we deal with those psychosocial risks in the same way we deal with other workplace risks, through an assessment and management of those risks to establish the preventive measures, then we can deal with it in a way that we can protect the health and well-being of workers and also contribute to the productivity of the enterprise. Every year we produce a report on the topic we choose. And in this case, we did an assessment of 20 years of scientific literature. We also assess grey literature. We developed a survey to ask our constituents what they were doing on it. And we assess legislation, list of occupational diseases, and furthermore, we did a Delphi study to do a forecast of future scenarios and to ask experts about trends. And it was very interesting to see that a key aspect, one of the key trends, or maybe I should say one of the key elements that would contribute to the improvement of this situation globally, is the involvement of policymakers and social dialogue. But awareness raising on this, the knowledge of the problem, the association between the causes and the consequences in case of understanding that work-related stress is not a disease, is the first sign of a problem, and therefore prevention should be the key way to deal with it through the prevention of psychosocial risks, is what ILO is promoting globally. And we're supporting our member states in order to do that. So I invite you to read the report, which is much more comprehensive than what I have said, and look into what we have found.